different than like.
Oh, okay, so if
And then they were like on me through like,
Yeah,
like,
Oh, okay.
but what they're like
It's not
pro-
gonna
project specific,
And actually
I
the
would do,
backyard.
like, obviously we're in a different with project, it's for
Okay.
massive programs, I'm asking for funding
Okay.
for a specific program. Last year I got funded for like.
So then they were like
grant with
on me, they were like,
conservation
this is the one we was like,
It was an annual, I think just like a person project, so that one's a little bit different. But the one that I asked for was specifically for.
That's what I'm asking about.
So like not much.
No.
I would just like
Okay,
highlight
so-
certain specifics of like different needs that you have this year that maybe you didn't have.
Okay.
I would do that, but again, this is like, this would be my.
We don't wanna follow
only
your
second
rule.
year. But for other
Good evening, everybody.
Good evening, sir.
I am calling to order the regular meeting of the Board of Health for April 15th, 2024 at, boy, that's a little bit wrong, 6:35 p.m.
Oh, I know, I bet those.
Same thing.
It's that time somewhere. I'm starting to get worried.
No,
I guess no,
I
it's
don't
not.
think it's not, I don't think it is.
Sorry.
You're right too.
No.
More?
Cheyenne, we do a roll call?
Oh, I'll do,
You do, Carly, you do a roll call.
okay. Mr. Clark,
Here.
Ms. Gaffney,
Yes.
Ms. Carden,
Yes, here.
Ms. Elsworth. Mr. Markison,
Yes.
Dr. Amsler,
Yes.
Dr. Katz.
Yes.
Oh, Ms. Ortiz, I'm sorry.
Yeah, that's okay.
Okay.
Another one of this part.
We got one more.
Oh, I'm
Thank you. Item 2 on the agenda is public comments. Anybody here tonight to give a public comment? Hearing or seeing none, we will move on to the next item, which is item 3, minutes from the March 18th
I'd like to
board
make,
meeting.
I have to do it.
I recognize Ms. Carmen.
Don't steal my thunder. I make a motion to approve the March 18th, 2024 minutes. Second.
Motion has been made by Ms. Carmen, second by Ms. Gaffney, to approve the minutes from the March 18th meeting. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it. Motion carries. I am removing item 4 from the agenda. We will address that at a future meeting. Item 5, department and division updates.
Okay, I'm going to start by introducing a new face around the table, Cheyenne Wachschel. Yep. Nice to meet everyone. She's our new administrative assistant in health administration, and so she will be working with Darlene, and they will tag team on doing board minutes and doing roll call and all those administrative functions, so we're happy to have her. And she's jumped on board great and are ready learning a lot.
Welcome.
Thank you.
Welcome. Good to have you here.
Thank you. Couple things. I wanted to give a shout out to Mr. Clark. He did an excellent presentation at the Committee of the Whole last Thursday about the Board of Health and our annual report, which I put in front of each of you. We got some really good feedback actually after the meeting, so got some kudos and shout outs for that. So that was great. And also, just a friendly reminder about Board of Health appointments. There's a couple of people. I checked the calendar again today on the county. I have previously sent out emails, so if you're planning on reapplying, we have 2 people who are up for that, and you will have to fill out an application. I will send a follow-up email as soon as that gets posted, and the county will notify me, but right now they're just showing the opening as the dentist because that is our empty position. So context there is every 3 years after the 3-year appointment, everybody has to reapply.
Who's up?
Mr. Clark and Ms. Carmen.
Oh, no,
Get on
Do not leave us.
I feel like I just started. I was like, what? I'm up.
Three years goes by quickly. And that's really all I have.
When you're having fun, or during a pandemic.
Or during the pandemic.
Miss that, bummer.
Director Karas?
I have a very short update just to let everybody know our Operation Dropbox is in its 5th year this year, and we're starting that up. For those of you who don't know what that is we use it as an emergency response collection and distribution exercise. And we collect donations for Veterans Path to Hope throughout the community. And then those supplies are brought in, and our MRC and our staff separate this out for delivery. And we involve DOT and all our partners. And if there was an event where we would have to bring in supplies and distribute, or bring in medications to distribute, those kinds of things. So this is a great exercise, and it gives back to the community as well. So we are out. We put out a press release just recently with his help to get, agencies, shopping centers, banks to put up our collection boxes throughout the community, and we've had a record response this year. Last I heard, we were at 57 locations, so we're super excited about that. We just want to let you know. Great.
What type of items do you want put in those boxes?
They'll be putting out a list here soon. They're working with Veterans Path to Hope. It's, usually it's just like personal items and things like that.
Any other questions from the board? Thank you. Director Howell?
Thank you. I just have a few updates for you as well. Tomorrow we have our first spring clinic, and we have 97 dogs out of 100 spots set up for tomorrow, so we're happy about that. That should go pretty well. We didn't do, sometimes we go up to 120, but we are training some staff on holding, so we didn't want to have too many at each time point, so that they could get some practice doing that. You probably have heard about the situation that happened on Friday. Just a couple updates on that. One is that we patrolled over the weekend 2 or 3 times each day. We do not know the whereabouts of the dog. Yes?
Does everybody know what Mary Ellen is? Okay, I think you need to provide some additional context.
Sorry.
I'll do the best I
Okay.
can without providing too much. There was an incident over in McHenry. An owner was having some of their dogs fighting. Multiple people were bit. An officer, law enforcement, was bit. One of the dogs was shot. We took some of the dogs into our custody, and then one of the dogs is still, we'll just say it, at large as far as we know. We've had a couple of sightings of the dog that's at large, but none of those have panned out, just a small handful of them. We are still working with PD. I had Janelle call them tonight, just so we could get an update on the last sighting that we had. We could talk it through a little bit. One of the dogs, as I said, is deceased. 2 of the dogs are in our custody. One of the dogs is still at home. We are pursuing some other things with the owner. And let's see, I think that's about all I can really say right now. Yes?
And these dog fights were on purpose? They were orchestrated to be a dog fight?
This is an owner home. The dogs got instigated together. So basically, she had some food. She had a newer dog. That dog wanted the food. It got instigated with another dog, and there were 5 dogs on a porch. So,
And it goes crazy from there.
And injuries included?
And some of the owner, as well as the neighbor, were injured.
Wow.
Law enforcement was injured. And then, like I mentioned, one of the dogs was shot to protect.
And the owner called
I don't know
animal
who
control
called
and-
911.
Oh,
So really, it was the PD's incident, and we were called to assist with some aggressive dogs.
And without giving away anything, is the owner requesting the dogs back?
I'm assuming the owner would like to have the dogs back, but we'll be going through some different processes with the state's attorney's office. Janelle told you about the cats we had in our custody last month. They did relinquish all of the cats to us last Friday. They did agree to pay for some of the vet care for those cats. And then we have a number of cats that we're slowly processing to see if we can place them. Some of them are still very sick. Some of them are catching sicknesses from each other. So we're just taking it cat by cat, moment by moment to see if we can help.
And these are the Kane County cats?
Their owners did live in, I thought it was Lake County, but maybe it was Kane. Are you thinking a different?
It's a different case, I was gonna ask about that one, you're thinking of a different one, the 80 cats?
There was a case right before ours in Kane County.
Mhm.
These owners did not live in McHenry County. They happened to come to McHenry County when this incident occurred. And then if you hadn't noticed, we are very, very excited to have transferred Brooklyn. She was with us since September. We were able to get someone to donate a wheelchair for her, and now she's in the hands of a rescue and hopefully will have a quality of life. So I'm excited about that.
Any questions? Thank you. Mr. Lovato?
Hi. Jeff Lovato, I'm the field staff supervisor for sewage and water with the environmental division. Patty asked me to just give a quick update for our SmartGov project. This is a partnered project with planning and development for the software for septic and well permitting, in addition to any building related permits, stormwater and zoning. So in general, if you're not familiar with it, it's going to allow an applicant to create in a single location, create a portal and apply for any building zoning or well and septic related permits in one location. So it's also going to allow for them to do online payments, paperless application submittals, permit reviews and permit issuances. It does allow for real-time notifications for permit status, so they don't have to keep calling us. They can look at the portal, get those updates. It's pretty fantastic that way. It also allows for web-based inspection requests and also notifications for inspection results to the applicants and to the contractors. So there's some other things it does for us, but it's kind of a summary. So we're continuing to work closely with planning development, our IT staff, and then the folks at Granicus, I believe, is the new company that recently purchased SmartGov. So there's been a little transition there on the change of ownership, but we worked through that. Luckily, we've been able to retain our project manager, so I think that's another much. We're currently wrapping up the validation phase, which is really just essentially the testing phase where we're applying for permits ourselves through the portal, reviewing those, issuing those, denying those, and seeing how that looks and feels, and making adjustments as needed. I've been meeting, Patty and myself have been meeting with our IT representative, planning development, and our project manager on a weekly basis. And we really hope that in the next 4 to 6 weeks that the health permit application process will be completed. So hopefully we'll get that online soon.
Any questions? Is there going to be a dedicated person monitoring for incoming communications?
That's a good question. So we will have our clerical staff monitoring that. Instead of giving individual alerts to everybody in the office, there will be a general email account that they'll give alerts to, but then yes, we'll have clerical staff monitoring that on a daily basis. So whether it's resubmittals or permit applications.
If a property owner is requesting an inspector to come out to inspect an installation, they would do it over the internet?
Yeah, either themselves or the contractor, if they're listed on the permit, can make that request.
And then how fast would the turnaround be?
It's typically the same day or the next day, and there's certain protocols, so there's typically a 24-hour notice period for inspections. In general, it's just the day before, and then we would schedule that with the contractor. We're essentially going to give them an AM or PM inspection slot, is the best way we found to do that.
Very good.
Question for you. Would this prevent them from calling if in case, okay.
And it also doesn't prevent them from applying in person or via paper, because we have the ability to scan in those documents. So we are going to have we have a few designers that still do hand-drawn paper designs, which is fine. But instead of getting, if you're not familiar with the process, each permit application takes 4 24 by 36 sheets of paper, in addition to all the shorts that we get, soil borings and other applications, those type of things. So it's going to reduce that quite a bit. I would say 95% of the designers have the ability to do that electronically, at least.
Thank you.
I did have one other thing I just wanted to mention. I was made aware last week, if you had heard, the EPA did set enforceable standards for PFAS. Those are for community water supplies, but I've already gotten some calls from private water well owners asking what that has to do with their water well. In particular, I think there was an article about the Marengo water supplies. And so, in general, it's a recommended value for private water supplies. In reading through the information myself, it looks like that the federal government is going to make funding available for testing of private water wells. So I'll keep an eye on that and try and get people informed and get them information as far as that goes. I think the level is 4 parts per trillion, which is a very, just to put it in context, comparison, I think it's 10 parts per billion, so this is a very small testing standard. So if you do receive questions or concerns, feel free to forward them to me and I'll help them out best I can.
So it's up to the communities then to have that tested and keep it.
So the communities will be testing through their community water permits from the IEPA.
Okay.
Will we have the capability to test for it here?
We will not.
Would you recommend out? Or
So
to another
I
county?
don't know how many private laboratories, Kelly, or lab persons here. I think there is testing through McHenry or Pace Laboratories now. We had a few other ones. We do have a list of private laboratories on our website that typically offer full spectrum of testing, but I don't know which ones are offering at this time. But we can get that information up on our website.
Thank you. Thank you. Director Barron?
Thank you. As reported last month, Public Health Week was April 1st through 7th. It was a great success. We had great attendance in all of our trainings. Our active shooter and de-escalation trainings were filled. So we are going to be offering 2 more so that other employees can get there. And if they couldn't make it the first round, we're going to have 2 sessions, seats of 30, so that'll be another 60 employees that can go that couldn't make it previously. We'd like to thank the Sheriff's Office. It was incredible, and to their team, and as well as our committee members that just put on a really nice week of very special events. So that would be Mary Ann Boffa of Environmental, Elizabeth Davies in Nursing, Deb Doran, Health Administration, Nick Kubiak, Health Administration, Connie Montana in Nursing, and Kathy Roundoff in Animal Control. The all-staff meeting was held. It was a great meeting. We had HR come and they really reviewed our health care plan and a lot of new things that are involved in that where you can save money that I think a lot of employees were very unaware of. They also talked about the new EAP, so that was very good information for them as well. We also had IT, our own Aaron Gemperlein, who was there talking about what the do's and don'ts of IT security, what we should be doing and shouldn't be doing, as well as our computer re-imaging. All the computers within the county are going to be re-imaged this year. So the health department is next on the list, and talk about OneDrive and all these other cloud-based things that are coming to us soon. We are also working with IT to get our vital records billing into D365. Right now, they work off a spreadsheet. It can get errors can occur. And so in order to have a workflow into D365, this will just make it much easier to bill funeral homes and what we do on a monthly basis. So we're excited to move that ahead. Our consultant, Mary from GovHR, will be coming in to meet with the directors April 30th on the succession plan. We'll review information on everything they've accumulated through the job descriptions, interviews, surveys. So it'll be compiled into core competencies. So when you have a job description, it will then have the core competencies so that employees that want to move up can look and see what they have to have, what they can have, you know, the technical, the non-technical, supervisory trainings and things such as that, and start putting together a staff development plan from there. So we're very excited about that. And we had gone out to bid through the local health protection grant for translation of our website, our ordinances. The bid was awarded to Alta Translation, who we also use for our translators. So if you go on the website now, you will see our ordinances there, and then there is also a place to say in Spanish, so you can get on that and read those. We're doing a phase 2 right now. for other website places, for letters, for documents, brochures that we will be handing out, and those will be in Spanish in addition to other languages that we work with every year. So it could be Ukrainian, Polish, just a whole bat of them. So that'll be our phase 2. You know, our special thanks to Director Howell, Director Karras, Director Nome, and all of their staff for getting all of this information together. This is a huge, heavy lift on the grant, and it's really moving forward. So thank you for all your hard work.
So,
Oh, you-
and it might be, I'm not sure who it's to, but, you know, I've been reading up on the Las Vegas hacking and the systems going down, just coming from something as simple as somebody wanting to reset their password. What do we have in place so that people that are remote, when they ask to reset their password, we know who they really are?
So
Well,
We
IT
go
does all
through
kinds
training.
of things in the
Oh,
background,
yeah.
right? They're constantly looking at all of these threats. They send us emails. Folks have to go through, they can't just log on to their computer, right? They have to go through,
a dual authorization,
I want to call it something else, but yeah, there is dual authorization. It's like a portal
a
thing.
portal, yeah. security.
That,
What?
VPN.
Virtual private network.
So there's several layers, then there's dual authentication, so there's numerous things. We have to change our passwords. I don't remember if it's every 90 days, but routinely have to change our passwords. I'm getting a guess from Ms. Clark. So they have lots of things that they're constantly fighting back, but the reason, you know, we asked IT to come is because it doesn't take much. You could click on a link that looks totally legitimate and a hacker's in and it will take down whole systems. And they've seen it, you know, other municipalities that have been taken down, large organizations, yeah. So it's very scary.
MGM?
And then they hold them for ransom, actually. And so the county puts a lot of emphasis on employee responsibility for knowing, you know, take the time, don't rush, use your preview pane, right? So you're not clicking on the link, check the, you know, hover over the sender to make sure that it's.
Well, I think from the most recent stuff is this not related to clicking on something, it's related to getting an employee's information, pretending you're them.
Oh,
and
yep,
then-
that happens too. And I think that, do you want to speak to that? I think it
Yeah,
happens.
so IT has started an entire safety program where periodically they will send out bogus emails to all employees. And any employee who clicks on that and gives any information then has to go to a special training. So
The naughty course. We
yeah,
did those.
the naughty course.
Yeah.
So they're constantly, and they send out a lot of
I have a
information.
zero.
Hey, there's a security alert, look for this, look for this, look for this, and the employees.
Yeah, I guess
respond.
from what we want in 60 Minutes, it wasn't a matter of someone.
No, they're taking our credentials.
They're taking your
And,
credentials.
right, and they're taking, I think, even logos. So the county's aware of that because I think it has happened to some employees, not necessarily in the health department, but I think it has happened in some of the divisions. So they're constantly looking for that. And then people are trying to be fake vendors or sending out for quotes or something like that, like from purchasing or something, right? They're pretending to be somebody they're not and
Yeah,
utilizing
this
county
is the case
information.
of someone impersonating an employee.
Yep.
And you'd think MGM would have better state of the art than we do, you know, and they got hacked. And so their ransom, they lost $100 million.
Yeah. I would say the
Being
county.
down, they didn't pay it, but the other, one of the other casinos paid, you know, something. It was just an interesting thing, so that's why I asked, it was on TV.
I'm not aware of that happening within the department, but I believe it has happened within the county. And so, again, it's like vigilance constantly, and they're looking for those things. And anytime, it's sort of like see something, say something. We all, in our Outlook, have a report spam button. So you can go ahead and report that, it automatically deletes it. And then if you're unsure, you can always reach out to IT and say, I don't know, like, was that legit?
Was that a customer?
Yeah, because they can then go and, like, they put, I think it goes into like a virtual space that's safe to blow it up or something. You know, those are, they're not literally, but then like they can go in there, see if it's a
Well, what
threat.
I'm thinking, the way that this seems so simple, is that they just needed to reset their password. So who in IT would not know that they're asking, someone else is asking to reset their password?
I would think they'd be able to see that. And then obviously if the employee tried to log in and they can't, I think we'd alert IT and then they'd quickly get into that, but it may be too late, that I don't know.
I'm reassured that the county is obviously taking the appropriate steps. They're looking at it in depth. They're doing the same thing that my employer is doing. It's a function of our connected universe. Other than going backwards and doing this all with smoke signals and writing triplicate, and we're gonna have this. So I'm glad they're taking a look at it.
Thanks.
What's that?
Anybody else? Manager Dietz?
So I just have a couple things. The DHS FAR audit is not finalized yet. They're hoping to have it for us within the next month, so I can bring it back next month. They have told us that there are no findings, so hopefully that's the final report. They're just waiting on one piece because P&D has a piece of this audit also, but they're waiting on it. And then on the income and expense report, the outside auditors are doing their final reporting and doing entries for fiscal year 23. So this month or March, they were working with finance and they did all the year-end entries. So there's revenue that we take in from December 1st of 23 through the end of January 24. And it relates to activities that we did in the previous fiscal year, so they move all that revenue back. So if you were to look at the revenue on one of the grant lines, it looks like we're negative $127,000 for revenue, but this happens every year. And then we'll catch up again, and then at the end of this year, the same thing will happen. So if somebody noticed that, she did, and asked about it, so.
Dr. Ambrose, she's on that.
She's on it.
I love it.
Best treasurer we ever had.
Thank you. Any questions? Dr. Tomaso, have you got anything to report?
No, I
Have you seen anything out there in the field?
Tick season has started.
Oh, yes.
Yeah, a few weeks in already. Strep and flu has definitely tapered down. We've seen kind of like the same strep kind of creeping in, but nowhere near to the degree that we did last year with the invasive strep and recurrence strep and that kind of thing. So that's kind of a relief for sure. But it's been quiet. It's been quiet and nothing alarming from from my my side of things. So.
Carrie Elhouse is good too.
Yeah. I ran into Kyle at the Carrie Elhouse.
Seen in the wild.
Yeah.
In the wild, yeah.
That invasive strep, you know.
Thank you.
Okay, thanks, yeah.
And that concludes the department division updates. We'll move on to consent agenda. I recognize Dr. Amsler in regards to the consent agenda.
Move to approve consent agenda.
Second.
Does staff need to make any comments or anything? Nope. Okay. Good. We have a motion by Dr. Amsler, seconded by Ms. Gaffney, to approve the consent agenda as listed on the agenda. Roll call vote, please.
Dr. Amsler?
Yes.
Ms. Gaffney?
Yes.
Ms. Rodriguez?
Yes.
Ms. Clark?
Yes.
Ms. Harvey?
Yes.
Dr. Katz?
Yes.
Mr. Barkison?
Yes.
And Mr. Clark?
Yes. Those in favor carried the vote. Motion carried. Motion passed.
I had a quick question.
Sure.
As far as a point of order. So if each time the consent agenda comes up and each time Dr. Amsler is there ever going to be somebody else that approves, that makes a motion for the consent agenda? Or in the case of the minutes?
Because we're not here.
Well, no, but I mean, if it starts with you, I'm curious. If it starts with you, then are you the person every single meeting that has to bring that up?
Technically speaking, while staff produces the minutes, once it comes to our table, because Ms. Carmen is the secretary, those become her minutes.
Okay.
So that's why typically she's gonna
Got
carry
it.
it.
Different from Dr. Amsler.
Dr. Amsler, the majority of our consent agenda is financial
Financial.
records. And she is the treasurer.
Got it. Thank you for the clarification.
If she's not here, you're the vice
It's
treasurer.
you.
I'm the vice chairman, you're the vice treasurer now.
I just want a point of clarification. So, thank you.
You're welcome. Item 7, contracts and agreements. B. Foster Marketing and Consulting.
So,
Yeah.
Susan's gonna take this one.
So we have been working, Patty, Nick, and I, on getting a marketing agency to help us develop our website regarding outbreak illness outbreak investigations, because they're so complicated. We do get a lot of questions, so we thought, we sat down and decided that if we could provide something that's easily accessible by the community to know what we're doing during an outbreak and what the expectations are and who's doing what, that hopefully that will help the public to understand the complicated process and make it simpler to understand. Because this is such a large project, we did receive some extra funding in our local health protection grant that we got permission from the state to use it for this purpose. So we did go out to RFP. We received 4 vendors that responded. We interviewed them together, and D. Foster was our selection. Because of the time frame that we're working with to get this done by the end of the grant cycle, which is the end of June, in this monster project, which they assure us they can get done, but we have to move on this pretty quickly. So the contract is not completed. So we're asking for permission pending the state's attorney's review. We have received the first review back from the state's attorney, which we're going to go back to D. Foster and have those discussions. But once it's approved, permission for Melissa to move forward with that contract. I can tell you that the money is set. It's a flat rate. It's just trying to figure out how that fits into the contract and that we're all on the same page, that is the max that they can use up through June 30th to complete the project. So that is what we're proposing tonight, is to go ahead and move forward with that contract with that set flat rate. Once the state's attorney approves the other pieces of that contract.
Does the board member wish to be recognized in regards to the contract?
I'll make a motion to approve the contract with D. Foster Marketing and Consulting.
Second?
Oh,
I think you might want to
Pending.
the state's attorney's approval.
We're not gonna, if for some reason we
It's
can't
not-
come
I
to,
apologize.
Yeah.
Thank you. I'll make a motion, I'll revise my motion, or amend my motion, revise it, to approve the contract with D. Foster Marketing Consulting pending approval by the state's attorney.
Second.
Here we have a motion on the table to approve the contract with D. Foster Marketing Consultant pending state's attorney's approval. Motion was made by Mr. Markinson, seconded by Dr. Amsler. As this is a financial issue, a roll call vote, please. Oh, excuse me. Any other board members wish to comment? Nope. Roll call vote, please.
Mr. Markison?
Yes.
Dr. Amsler?
Yes.
Dr. Katz?
Yes.
Ms. Clark?
Yes.
Ms. Gaffney?
Yes.
Ms. Ortiz?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes. Those in favor carry the motion. Motion passed. Item number 8, program highlights. Now we're going to get a presentation on the sharing tables.
yes, so,
Did you get a snack?
I don't think they have brought any snacks, but we have Kelly Beckman and Christine Miller, both from Environmental Health. I know Ms. Carmen has talked on several occasions about sharing tables, so we thought we'd do a program highlight, and I'm going to turn it over to them and scoot out of the way. Thank you.
since it's like all round table here, where would you like me to stand?
Right in the middle. I'm just kidding.
I don't have to sit down, you can sit down. I'm good right here, if y'all are good with me being right here. Okay. I'm Christine Miller, I'm the field staff supervisor for the food program for environmental division. My colleague Kelly, I'll let her.
Hi, I'm Kelly Beckman. I am the solid waste manager for health department.
Okay, as you already heard, share tables have been a topic lately, so we were going to go ahead and just give you some information on it. So the first thing we wanted to do is to indicate what is a share table. So that is when
Sorry.
Oh, it's over. Oh, okay. Sorry. It's when we have uneaten food items that are collected to reduce food waste within a child nutrition program, so within those schools. So these uneaten food items are actually available to students during other lunch periods. So if they're hungry, they can go partake in that share table. Next one. So we did want to go ahead and indicate, MCDH does support the use of these share tables to reduce food waste, but it is contingent upon assuring the wholesomeness of the food that is being offered. So this is something that's been practiced for decades. This isn't anything that's new out there. These are, the foods do have universal food safety principles that do apply. But the best scenario for reducing that food waste is actually to allow these children to decline unwanted food items. However, I know sometimes the federal government doesn't allow for that aspect. So when it comes to these food items, we do have food safety standards that do apply. So we want to make sure that the foods are from an approved source. They are packaged to protect from contamination. There is no reservice of unpackaged foods, that these foods are stored in an appropriate location. If they are items that require refrigeration or hot holding, that they are under temperature control and that there is staff oversight. Now, these schools that do partake in these share tables, we do go ahead and review these share tables with the staff that's on site, and we do inspect that during the routine inspections when we do the cafeteria inspections. There are some other considerations, though, to go ahead and think about when they do share tables that aren't always included with some of the informational packets that go out. There are those dietary restrictions that we want to have known for those children and those allergens as well. But we do recommend that there is some notification that goes out to parents about these share tables, as well as the outline of their protocols. So as I had indicated, this isn't something that is new to the area. In 2013, there was an informational brochure that was offered by Illinois Department of Public Health as a result of the USDA making it a requirement for kids to have certain foods, which then increased that food waste. So we just put on there that memo. It's kind of hard to see, but if you need a copy, you can always let us know. We can get you a copy of that. So what is allowed on a share table? So when we look at it, we want to make sure that the school, those items that they're providing, you can go ahead and put those whole fruits on a table. So if you have banana, oranges, manufactured sealed packages that don't require refrigeration, so granola bars, applesauce, cereal boxes, and then the manufactured sealed packaged items that do require refrigeration, such as milk, yogurt, some cut fruits. And then if they do require temperature control, that temperature control is provided somehow, or they can go ahead and utilize times of public health control. And the foods that are not allowed, you want to make sure that there are no items that are being put down that are prepared from home, any items that have been opened, punctured, or compromised. Any items that are in resealable packaging, or any unpackaged foods that have been serviced or dispensed from the cafeteria line. And then for those items that are on the share table, if they do require temperature control, we want to make sure those cold foods are held at 41 or below. If they are hot foods, that they are held at 135 or above. And how they can go ahead and do that is they can utilize containers with ice packs, they can utilize insulated hot or cold holding units, or they can utilize mechanical hot or cold holding units as well. Now, if they are utilizing times of public health control, they do have to go ahead and monitor and make sure that they are discarding or consuming that food within 4 hours if there is no temperature being held. And that does require written approved procedures before they can go ahead and utilize that Now, of course, we want to make sure that any school that is utilizing a shared table, that there is monitoring taking place to ensure that the food is not being compromised. So we want to have a designated adult. Children can help that adult along the way, so they're learning that process as well. It's a good educational purpose for them. However, when they are doing it, they want to go ahead and if they are foods that require temperature, that if they aren't utilizing that temperature control, that the foods are discarded after that 4 hours. Or if they are utilizing temperature control, that they are being held appropriately in mechanical cold holding and hot holding, so they're monitoring those temperatures. And then we want to make sure that they are cleaning, sanitizing those tables between uses. And then what happens after the lunch period, they can go ahead and utilize those shared table items again, but they have to do storage appropriately. So they want to go ahead and make sure that it is separate from the cafeteria foods. So there's no commingling with the shared table items, and they have to clearly label that. They want to make sure that they do first in, first out, just like they do at grocery stores and things like that at food facilities. They want to go ahead and monitor for wholesomeness and the quality of the food. And then these same principles apply if the school is going to be donating those items from the shared table to food pantries or the backpack programs. They want to make sure that they do have a designated trained person to go ahead and monitor and evaluate those items that will be delivered. And then we just wanted to let you know we do have an informational page that we will be sharing with county schools. We'll go ahead and email that. We have the ability to mass email that to all of those personnel in the kitchen. And then we're going to be adding this to our website as well. And that is it. Do you guys have any questions for me? Or Kelly?
Can parents that are in need apply?
The shared table items cannot be actually offered to adults. This is something that is only allowed for students.
I didn't know if it could for their take home, for the kids to take home.
That's that backpack program, so if they're in need, there is a way for them to be able to designate that to the school so that the children can get that.
Are there schools in the county that are doing this?
Mm-hmm.
No. Do you know how many?
I do not, I'm sorry, I apologize, I
No,
don't have
there's
that
a few
number.
in Crystal Lake and Huntley. It's just the rules they weren't for sure what the rules were compared to like McHenry County versus the state. So that's why a lot of schools, like when we brought this up and the defenders, they were having issues. That's why it's great that these guys have finalized, these are the rules for the county, and then all the schools will no one has to worry if they're, if they're not following the local rules on the shared tables.
How do schools navigate food allergies? Because I think this is an amazing idea, but I'm trying to think from like a school admin perspective and the things that might come up that would prevent like a principal or someone from that.
So it's on the school themselves to actually put through some type of procedure or protocol for the shared tables. Mm-hmm. So they would have to do their own SOPs to be able to offer this. We could take a look at it, but we're not approving of anything like that. But we could put that recommendation forward for allergens. But most schools nowadays have that aspect kind of filtered in anyway when it comes to, students that have like a peanut allergy, peanut butter free area, that kind of a thing. Mm-hmm. So that's where that monitoring would come in play as well for the share table for that designated adult to be able to monitor what's going on there and be able to separate it or allow it possibly. That's on the school if they would.
A two-part question for you.
Sure.
Is this for all grades?
Yep, any school.
And is there any recommended pathway or concern about, I'm thinking like stigma for children, a way to avoid that, you only go to that table if you're poor or.
No, it's available for anybody. So I mean, if your child all of a sudden doesn't like their food and their lunch, they can go up to the share table. You might not like that, but.
That's what I was wondering too about parents. Like I know some people will monitor for their own kids what goes to school and what comes home, so they're aware of what their kids are eating. But again, then those kids could just not participate.
And if I understand correctly from your presentation, this is only food that the school provided? Or is it's food that the kids bring that they don't want? I don't like this.
Yeah.
This.
Mom gave me an apple.
I don't like a banana. I want an apple today. are they putting food on the table?
The students are allowed to go ahead and put foods on there.
Oh, cool.
Most of the time though, it's actually the fact that it's from the school itself, because that's a stipulation that the school is gonna be putting on. If it's a granola bar that's brought from home, the school can say, no, we don't want you putting it on there because of the fact that they don't know where that's stored,
Sure.
how it's handled.
Right.
But it is manufactured, sealed packaging, as long as there's monitoring, that possibly could go on that table.
That's cool.
Sorry, so that explanation just threw me. The food is from the school or it's from kids?
The school itself, anything that the school offers that we went over that's an approved item can go onto that table, definitely. It's a little bit wishy-washy when it comes to the aspect of kids bringing in an item from home. If it's prepared at home, definitely not. So if you're making a peanut butter and jelly, that can't go onto the table at all. If it's carrots that have been opened from, package and it's in a sealable bag or something, can't go on there.
Yeah.
But if it's like a granola bar or something from manufacturer, it's kind of up in the air on that aspect. It's dependent on the school if they'll allow for that or not. Because of the fact that
Your
if
policy
I'm-
would allow it?
Yeah.
Okay.
I'm just giggling because both of my kids came home today with cut cucumber and cut cantaloupe. Those are like the two things that they didn't eat. I'm like, you guys, these are healthy things.
Well, just look forward to the
Put it
future.
back in tomorrow.
They ate them as a snack before they could have anything else, but I'm just saying, like,
Careful, you'll just teach them to throw it out, and then you won't.
I know.
My brother used to hide it in his toy box until my mom went in there to clean it, she smelled something. Then she found out.
So the after-school program that I work for, they do Northern Illinois Food Bank, and Northern Illinois Food Bank is like, they have a shared bin. And I realized that we have more control that way, because youth are sharing lunches regardless. So if anything with allergies, we feel more comfortable where you guys could share, but it used to go into the shared bin and then, but I understand everybody else's concern because we only get lunches from them. No one's allowed to bring lunches within. So it's just, we know the lunches that are there, but we have more control where it goes in the bin. And then there's staff that are overseeing the shared bin, and they know the students that have allergies, and they're watching to make sure that they're not grabbing something that is not, but they're sharing regardless. And so when we see them sharing, hey, I know it seems silly, but let's put it in the share bin, and then you guys can select from there. Just because it's more of a controlled, procedure, I guess, for them to put it on the table. And then you could see what they're doing instead of them having a conversation. Let's just switch this, right? And fool our parents that we're actually eating that there's more control on, watching for allergies and other things.
How can we help promote this? I meet weekly with superintendents and the regional office of education and principals and just for my job. So we're talking about the health and wellness of the kids growing up in our area. How can we support you and this program?
As of right now, we do have the personnel within the cafeteria itself that we'll be reaching out to. Some of those individuals are also the food service directors for the district. So I do have the ability to go online and actually find out some of the superintendents and things too, so I can always email that informational sheet as well. But if they have any questions, if they ever reach out, or if you wanted to, the word out, we can definitely help out with that.
And it's really, for us, what we've done with the Defenders is just getting the parents involved and the parents asking, talking to that principal. We've had many meetings with different with the food service directors and just kind of slow on getting this stuff done. So yeah, any parent emailing their principal, hey, why don't we have a shared table? Where is this extra food going? Those kind of concerns really makes a big difference. Okay. Yeah. And one thing we're working on too, because when she talked about, about being offer versus serve. So the kids, in a meal, there's 5 components, but the federal law is they can be offered, but they only have to take 3 components. So they can say no. So that is decreased a lot of the schools that are doing offer versus serve. They've, one school, it was 70 bags of carrots first at the share table, went down to 10 bags of carrots at the share table because it was offer versus, they were offered and they could say no, which they didn't know they had to before, so. Right. So those two things, I mean, it's really decreased, the school's doing both, really decrease the food waste. So.
Is this program available to both private and public schools? If you envision in the future park districts or summer camps, expanding this to other organizations that provide meals to children?
That's a good question.
Or daycare.
Yeah, well, a lot of those summer programs, the kids have to eat the food there. You can't take that. You have to go there, eat that food there and leave, so that would be an issue with that, taking them. I know they're looking at, other states are looking at giving vouchers to those kids instead of going to get the meals, so.
Yeah, like if they're too shy.
Right, like they can go to the social worker's office and grab.
Any further questions?
Thank you.
Thanks for having us.
Thank you. Sorry, I had one more.
Oh,
Oh, go ahead. I did not see, I was like, I was thinking a little bit about stigma. Is there any way, do kids ever come after lunch and ask if they can like grab some of that stuff to take home?
I can't say that they have. I mean, that's something that we could always ask the schools. I don't know that, personally. However, they do have that backpack program I heard about where, those kids that do need a little bit extra, they have that ability to.
And they're allowed to use some of the items in the shared table to take to their backpack program?
As far as I know.
Okay.
Yeah.
The kids, our friend, they have it at their daughter's school, and the kids just love it. Oh, free food, woohoo! They take it home, and she's like, this is for people who can't afford it. But Mom, look at this pretty apple, so I think it really depends on the kids. Like each individual kid, there's a stigma because her kids, no, there's no
I
stigma.
think with little kids it would be fine.
Right,
I have
yeah.
kids there.
And I think it's very difficult to do in the high school because it's usually a la carte.
Yeah.
So you're paying for each item, so I don't think they really would even need the share table.
Yeah.
Well, I know that's how it is at Huntley High School.
I appreciate your program because it seems common sense. And there are kids that eat more and some that eat less and they go through growth spurts and some kids are hungry.
It's like win-win, you're feeding kids and reducing waste.
Yeah.
But I think, having the health department be on board with this is gonna be, because you probably hold back. I don't know if this is loud, right? Like, I don't know if this will, with the health permit that I have, allowed this. So I think this will be a huge step for school districts to feel more comfortable where, our county's on board with it. So, thank you.
You had a question?
Could we get a copy of the slide before that had all of the things that were acceptable, the temperatures? That one?
Yeah, I could share the
What's not allowed,
slide deck,
what is.
and then maybe when you get ready to send out the flyer, just give me a heads up and I'll send it out to them. Or
Sure. Yeah, sounds good.
Thank you.
All right. Thank you very much.
Oh, thank you.
Thank you.
Well, I don't think it's on that way.
the technology that does freaking.
Pretty
slick. Yeah, I think it is.
Is there any new or unfinished business before the board?
New world.
Old business?
Just me.
Any board members have issues that they want to discuss?
Taxes.
Today?
I know.
No. I don't want to.
Wrong meeting.
I would like to call attention to the board, two things. As identified early in the meeting by Mr. Adamson, we did appear before the county board to present our annual report to them. And I spoke on behalf of the board, stating how much we appreciate the support from the county board. And because of their strong support, it makes our positions have more value. And so I did share that comment with the board as a whole. And also, in the dialogue between us and some of the county board members, when they look at the health department, just like Ms. Ortiz did here just a moment ago, what's the health department going to think about it? This is regular, everybody looks towards the health department as regulatory, you have to do this, you gotta do that, da, 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 da. And in the presentation that we made, there was a lot of this stuff that we're talking about here, the share table, the programs that are beneficial, that make people's lives easier, answers questions, gives them support. And it was very noticeable that the county board members were going, huh, okay, yeah. Yeah, it's not all regulatory. There is a lot of good that this health department does that is worthwhile and meaningful to our public. So I wanted to share that with you in regards to the board presentation. And then the other item is Melissa and I did meet with the county administration to discuss some of the details of her goals and her performance evaluation and how she can work towards getting those goals completed. And so I just wanted you to know that I did meet with the county administration. And that is all I have.
I just wanted to circle back around to that. For one thing, I feel a little bad that you attended it by yourself. I know we had talked about it before. I feel like we could have given you more support, and I apologize. It slipped my mind. But also, thank you so much for doing that, both of you. Obviously, I know you're before the county board a lot, but I don't recollect. Is that something we've done in the past as the board to go to the county?
I went for something.
The way back times.
I'm sure it's happened, but I just want to say I appreciate that extra. I think it paints us in a good picture, in a good light, and anything that we can do to build that relationship, I think, is positive.
I know we met with the county board or their committees when we were discussing the restructure of the facilities. And we met with the board members on that. In regards to the annual audit, I don't recall that being before. I think it was a good event.
Yeah, it could be something that we do every year at this time.
It's a good idea. It's a great idea.
Yeah, this is great.
It was a very comfortable environment.
Report.
Yeah, they had a lot of questions and comments.
Did Pam introduce you or?
No, but she had positive comments
She had
as
comments,
well. Yeah.
very good comments. Sue? Information and communications. Ariel, would you care to comment on the happily ever after? I found that kind of interesting.
So we always try to do happily ever afters when we can, because we always want to show that positive side of what we do. The community outreach, as you just mentioned, that we can offer. But we have just a couple of things that, we are proud of. We are proud of Brooklyn, as I mentioned during my conversation. We have a few other court case animals that we're always very pleased when we're able to, one, give them medical attention, two, give them just the positive interaction with people, and then three, giving them that happily ever after home, right? Like we hope that each of our adoptions ends in a forever home for them. And then you probably noted in there that barn cat program. We have placed cats in barns before, but we are trying to do a little bit of that ourselves as well, just because there's the resources in the county and nationally are just a real struggle for different types of programs. So we just had a really nice week last week with adoptions, so we're happy about that because adoptions are critically down nationally. So, and I think we had like 4 or 5 adoptions last week. So yay! Whenever we can have a positive placement for an animal, that's a good thing. And we're really trying hard to do special programs like our vaccination registration that we're doing tomorrow. We have very specific rates that are pretty low. So we want to be able to try to help the community financially when we can.
Thank you, appreciate it. The other item, information communications, the all event flyer, that's from the environmental division in regards to the recycling events. It's listed in your packets. Need anything recycled? Please use these opportunities. Would you care to say anything, Jeff?
I didn't have any.
So we have, in the past 3 years, we've had an HHW event, the Household Hazardous Waste event, which is actually open to all Illinois state residents. We were hoping to have another one this year. Right now, the state was renewing their contract with the hauler that comes and sets up the event and handles the waste. And that process got delayed, so they're probably not doing any same-day events this first half of the year. So we might be able to slip one into the second half of the year, otherwise definitely we'll be on the list for next year for that. But otherwise, these are our electronics recycling, our partnerships with Environmental Defenders to do styrofoam, batteries, bulbs, and textiles, and then also document shredding on site.
Any idea of a tire recycling?
Possibly, but not sure yet.
Okay, all right. I endorse that one. That's it on the information and communications. Is there a need for executive session? Not seeing any. The appendix with all the reports from the different departments. And I will entertain a motion to adjourn.
So moved.
Motion made by Mr. Markison, seconded by Dr. Hansler. All those in favor, aye?
Aye.
Opposed? Ayes have it. We're adjourned.
Thank you.
I'm a consumer of this chair.